Hi, welcome back. Dr. Glenn here to lesson 2 of module 3, and this is one of my favorite topics. And the reason it is because for the longest time I was a denier. I didn't think that leaky gut actually existed until I developed my gluten problem and my leaky gut problem. Ever since that happened to me about 4 years ago, I have been reading everything that I can find on it, and I try to stay as up to date as I possibly can on the literature. So today we're going to talk about, in this lesson, leaky gut syndrome and its relationship to gluten. So here's what you're going to discover. You're going to discover what leaky gut syndrome is. And it used to be called in the literature intestinal hyperpermeability, but now it's easier just to write leaky gut, okay? Now, the symptoms of leaky gut, what kind of things you can expect, the causes of leaky gut syndrome, and how we test for it. It can actually be tested for with a blood test, and the importance of leaky gut and what all it can do. You're wondering how your labs can be normal. You've probably been told that your labs are normal, and we're wondering, is it leaky gut? Okay? Is your doctor listening to you? Is he saying there's nothing wrong with you, it's all in your head? No, maybe it's in your gut. Wondering what is exactly going on. Well, we're going to go over that today, and you may be wondering if you're even going crazy. And this is the origin of my friend Datis Karazian's book about thyroid. It's a great book about how can you feel so bad when your labs are actually normal. You wonder if you're just going nuts. You're not going nuts. Okay? It is rare for a person with a chronic medical condition not to have leaky gut syndrome. And this statement, you can go back to an article published in Scientific American in August of 2009 where Dr. Fasano sort of proves this. The average person may suffer for years because of doctors treating the symptoms and not getting to the root cause, and that is leaky gut syndrome. Let's talk about the epigenetics one more time. We went over it back when we talked about Hashimoto's, but I want to bring it up here because I want you to really understand how important your environment is in your health. So if this is your genetic makeup, there are several things that can affect your genes. One is your nutrition. As a matter of fact, food is the single most influential factor in your health. It trumps everything else. But also, in addition to nutrition, is movement. Do you exercise? And I'm not talking about exercise for your heart. I'm talking about exercise because of the chemical changes that happen, the good chemical changes that happen in your body when you move. Also, your emotions have a profound impact on your epigenetics. Remember this. We talked about this before. 75% of your expression or your health is due to your environment and not your parents. Okay, back to the illustration that we used before. Remember that the walls on the floor plan, that's hardwired genetics. You can't change those, but the ceiling fans, those are in there, but they can be turned on and they can be turned off. And one of the biggest factors that turn on and off things in your world is what you eat. Think of leaky gut, as we're going through this, like a broken fence. If that fence is designed to keep the dog in the yard and the fence is broken, what's going to get through the fence? That's right, the dog gets through the fence. So think of leaky gut as a broken fence, okay? Now, we're going to leave the slides for just a minute, and we're going to go over to my desktop, and I'm going to show you a little video. Okay, so here we are. I'm going to show you this, and what I want you to notice here is if this is the inside of the gut, okay, these are the cells that line the gut. Now, when we have zonulin introduced, here's what happens. Zonulin comes along and it breaks down these tight junctions between the cells, and it causes the food to go down through the cells and into the bloodstream just like that. That's not a good thing to happen. Another thing that zonulin does is it will actually break the cells themselves apart, and it will let undigested foods go down in through the cells, and that becomes just a huge opening in the gut. And this is what the broken fence is. It lets things from the gut into the blood that aren't supposed to be there. Okay, let's go back to the slides now. All right, let's talk about zonulin for just a minute. Zonulin is a protein that modulates the permeability of the tight junctions between the cells of the wall of the digestive tract. It was discovered in 2000 by Alessio Fasano and his team at the University of Maryland Medical School. And we're going to talk about this later, but it takes about 17 years for research to reach clinical practice. So if this was discovered in 2000, it takes a couple of years to publish it. You're probably realizing now why most doctors have never even heard about it. We didn't even know it existed when I was in school. So look at this here. Follow the arrow in the top picture and you will see what a tight junction between two cells looks like. It's made by this stuff called a gluten, okay? And what happens is if you go up to the top, you see zonulin is a little protein, and it goes and it's going to fit into those two little keys. And when zonulin goes into the keys, go down to the bottom picture, follow the arrow, and you'll see what happens to the junction. When zonulin enters the picture, it triggers the junction between the cells to break apart. Now what you have is you have a broken fence, and stuff can get through the fence that isn't supposed to. I want to talk about glyphosate because gluten is the one that everybody talks about, but this is actually more damaging. Glyphosate is a pesticide, and it is the active ingredient in Roundup. Glyphosate causes an increase in the production of zonulin. Remember, zonulin breaks down your intestinal lining. It causes the tight junctions to split. All right. Glyphosate has been shown to be more damaging to tight cell junctions than gluten. And actually, I'm not trying to overshare, but glyphosate is the problem that I have. It was triggered by gluten, but my biggest problem now is with glyphosate. And you can find glyphosate in genetically modified corn chips. So if you eat corn chips with salsa or guacamole or something like that, and you feel bloated and not too good afterwards, it's probably the glyphosate. But we're going to get to that in food triggers in another lesson. Look here, look at the top picture on the left here. You see all the dark color, that dark browny rust color, and that is where glyphosate Roundup is used a lot on crops. What you'll notice is that what we have here really is the drainage system or the sewer system for the American continent. So the tributaries of the Mississippi all feed this stuff into the Mississippi and then down into the Gulf of Mexico. In the bottom picture, you can see the increase in the use of glyphosate or Roundup since the early 90s when they started to spray it on crops. And you'll see how it's gone up in spraying corn and soy and wheat. So you don't want to be eating corn that is genetically modified because it's been sprayed with the Roundup. Also, you really don't want to be eating things with soy in them, and you should certainly not be feeding babies soy-based formula. That's really not a good thing. In this graphic here, you can see the increase in thyroid cancer with the increase in the use of glyphosate. You'll notice it all starts in the early 90s. Pretty interesting. This is a really, really interesting little picture right here. On the left, these are intestinal cells, and you can see that they're all joined up together nice and tight. When you introduce glyphosate into the petri dish, you see what happens to the cells. You see how they break apart. All those black holes in between the little green cells, those are holes in the intestinal lining. That's where the stuff goes through. So this right here is an actual microscopic view of leaky gut. Let's talk about gut and brain leak for just a minute. This is really important, and especially in our kids, but actually in all of us. You have gluten and glyphosate both create toxic peptides in the gut. These toxic peptides cause the creation of our friend zonulin. Now, zonulin causes the tight junctions between the cells to break down. When the tight junctions break down, we get leaky gut. When you have leaky gut, you have everything that is in the gut can now get into the blood, including the zonulin. Now, where does your blood go? Your blood goes everywhere. So now you have zonulin going everywhere. Zonulin breaks down the tight junctions in all of your tissue, kidney, liver. Everywhere it goes, it tends to break the junctions down. So when you get leaky gut, you get zonulin into the blood, you get zonulin everywhere. When zonulin gets into the blood and goes everywhere, it goes to your brain. This is not a good idea. The blood-brain barrier is one of those sacred things that is designed to keep bad stuff out of your brain. When you break down that barrier, you get things into your brain that are not supposed to be there. And when that happens, you create an inflammatory response. Ever wonder why ADD, ADHD, autism, and all these things are on the rise? It's because we're breaking down our blood-brain barrier. We're going to talk about that a little bit more in just a minute. Signs and symptoms of leaky gut? Well, facial swelling upon exposure to strong smells, bloating, gas, and cramps shortly after eating, alternating constipation and diarrhea, immune system imbalances, muscle aches, foggy brain, I mentioned that, ADD and ADHD. When you get inflammation in the brain, your brain doesn't work like it's supposed to. Poor sleep, food cravings, headaches, just lots and lots of things. Irritability, arthritis, and joint pain. All of these things have an origin in leaky gut. It's just amazing how interrelated everything is. Let's talk about a conflict of interest here. This is amazing. These hamburgers and French fries were all purchased on March 22nd, 2010. They don't look like they're rotting, do they? Maybe there's something there we shouldn't be eating. Check this out here. After 6 years, our chicken nuggets and our French fries still look like this. This stuff is full of preservatives. It's why it doesn't rot. It may not be a great idea to put stuff that will not break down well into your digestive system, where you need to break it down to get the nutrients out of it. Be careful of this stuff. Okay, triggers of leaky gut. Let's talk about a few things. Inflammation of the gut lining is the underlying factor in leaky gut. Gut inflammation is usually triggered by one of the following: prescription hormones like birth control pills, and I've even got a little bonus lesson for you on birth control pills in Module 5. Hormone replacement therapy, viral or bacterial overgrowth in the gut, prescription corticosteroids and anti-inflammatories. Those are just terrible on the gut lining. Antibiotics, of course, antibiotics are supposed to kill bacteria. Antibiotics kill all bacteria, not just the bad guys. Now, sometimes if you have an infection, you need one. But if you ever have to take an antibiotic, please always take probiotics with it, and continue to take probiotics for several weeks or up to a month after you finish the antibiotics. Decreased stomach acid will lead to leaky gut. Gallbladder removal will lead to it. You can't fix your parts if they're not there. Now, sometimes it has to come out because of what we've done to ourselves leading up to the gallbladder problem. But if you can keep it and somebody wants to take it out and you can keep it, keep it. Chronic constipation leads to leaky gut because of the increase in toxic buildup. Antacid medications, both prescription and over-the-counter, you should not be taking those. You need to fix your thyroid, not take antacids. Processed foods and beverages can be contaminated by parasites, fungus, and mold, and that's not to mention the artificial sweeteners. Increased refined carbohydrates drive inflammation. I want you to think of carbohydrates and sugar like gasoline. You pour gasoline on a fire, you ramp it up. That's what carbohydrates do to inflammation. Candy bars, cookies, cakes, soft drinks, all of these things ramp up inflammation, ramp it up. Chronic stress, of course, ramps up inflammation as well as does the increased consumption of alcohol. Now, I am fine with a glass of wine or a cocktail in the evening, that's okay. But when you're drinking 3, 4 every night, something else is going on, okay? Conditions that are linked to leaky gut include autoimmune disease, chronic fatigue, diabetes, chronic pain, fibromyalgia, sleep disorders, anxiety, depression. This is a big one. The incidence of depression in North America is just frightening. Poor memory, heart disease, chronic food allergies, and a suppressed immune system. All of these things are linked to leaky gut. How do you test for leaky gut? Well, you can do a blood test, and we run this sometimes if we need to. This is a test from Cyrex. It's called an Array 2. Some of you may be aware of this. And all of these things that are listed should not get into your blood. So if they get into your blood, you know you have leaky gut because they're supposed to be in the digestive tract and not in the bloodstream. Now, what I do today, or let me put it this way. Sometimes I'll get a patient that is just so skeptical of leaky gut. They've heard so many people say, oh, it doesn't exist. I don't believe in that. Then I'll say, okay, let's run the test. If I'm right, you've got to change the diet. If I'm wrong, you can keep on eating the junk you're eating. Well, that's when I run this test. Okay? It's important to understand that leaky gut syndrome is a result of many variables that are linked to diet and lifestyle. The symptoms of leaky gut can be widespread due to the central nature of the problem. The gut, like Hippocrates said, is the seat or the root of all disease, and he was just about right. New testing techniques can accurately identify leaky gut. We can run that if we need to. But because of the prevalence of leaky gut syndrome, I start all patients off with the assumption that it's present, especially if you have Hashimoto's. Because like Dr. Fasano proved, you have to have a leaky gut in order to trigger an autoimmune disease. Don't ever forget that Hashimoto's is an autoimmune disease that attacks the thyroid. It is not a thyroid disease. Okay? And leaky gut syndrome can heal and repair when you take the appropriate diet and lifestyle changes. Now, let me say something about this. Remember that your intestinal lining is made up of what we call epithelial cells. That is skin. If you cut yourself or scrape yourself, how long does it take to heal? 3 to 5 days is usually what we say. It's the same thing for your gut lining. If you get the bad stuff out, and put in some good support and encourage the healing, your gut will heal in 3 to 5 days. It is amazing. So having leaky gut is not something that you say, oh, I have leaky gut, and you keep saying that for months and years on down. If you have leaky gut and you do the right things, it will heal and you don't have leaky gut any longer, which is a wonderful thing because if you get rid of the leaky gut, guess what else goes away? That's right, the thyroid problem will heal. That's wonderful. So why didn't anyone tell you this before? Well, this is the frightening fact. According to the Royal College of Surgeons in London, clinical practice is on average of 17 years behind the published research, which is why most doctors in their offices today are still practicing 1990s medicine. Down the rabbit hole. What's the rabbit hole for this? Don't get hung up on leaky gut syndrome. Know that it's real, it's serious, and it is fixable. The body has an amazing ability to heal and regenerate. Do the right things, your gut will heal, and leaky gut will be a thing of the past. Now remember that if you go back to eating the way you used to, guess what comes back? The leaky gut comes back. But if you do the right stuff, your body will heal and you can move on and take care of other things. Okay, this is Dr. Glenn. Have a great day today. Get out there and enjoy life, okay? And I'll see you back in the next lesson. Bye.